We will be posting both the slides and the recording on our website, which I'll show at the very end, and that'll be up in about a week. We are asking folks to reduce distractions and background noise, to please send your calls to voicemail, silence your ringers, and really don't put us on hold, because we really hate getting that music, even though it may be lovely music. And what we are going to do is we're going to have all of the speakers actually unmuted. Right now, all the attendees are muted, but we may unmute you for the question and answer period. I can see that not everyone put in their attendee number when they called, in which case I can't unmute you to speak, but you are more than welcome if you are on a line that can be unmuted, or if you're just simply on a separate line, you're welcome to ask any questions using the chat box. If you've got any logistic questions, please just send those messages to the host. And if you've got questions to the speakers, just put them actually, you should see in the bottom right, send to, and you can put that in as all participants so others can see what the questions are and they won't necessarily repeat your question. We're going to have the speakers talk for about 45 minutes at the most, and to allow for a fair amount of time for questions and answers today. And if you do want to ask your question in person, you can raise your hand. You should see a hand icon on the right side of the screen next to your name, and I'll be able to recognize you then. And so today's speakers, we actually have three, all from Kaiser. The first will be Christy Zuber, who's the Director of the Innovation Consultancy at Kaiser Permanente. She is a nurse with a phenomenal passion for design and is the director of what they call the Innovation Consultancy within Kaiser Permanente. And many of you are pretty familiar with Kaiser as a non-for-profit integrated delivery system that now provides healthcare to over 8.5 million people every year. So the purpose of the Innovation Consultancy is to develop human-centered designs that positively impact the experience of Kaiser patients and the clinicians who care for them. So it's a unique way of really trying to improve the experience both for providers and patients. She's been with Kaiser since 2001 in roles that have encompassed finance, strategy, facilities design, and her current position, is with the Innovation Consultancy, which she started to build in 2003. She has partnered with IDEO to learn and internalize the human-centered design methodology and bring that into Kaiser. And she and her team have spent thousands of hours shadowing, conducting ethnographic observations in clinics, hospitals, and patients' homes, and field testing ideas in the front lines of healthcare. And she's going to provide a lot more detail about the kinds of projects that they've done. She has a master's degree in health administration and a Bachelor of Science in Nursing from the University of Oklahoma. Her actual nursing roots are in home health care, and we're delighted that she'll be able to speak with you this afternoon. She'll be joined by two other nurses from the field with whom she's worked on various projects. One is Tracy Mahan, who's a registered nurse with over 20 years of nursing experience. She has a bachelor's degree and a master's degree from San Jose State University, and she was recently board certified in pain management through the American Nurse Credentialing Center. Her experience has been in a variety of settings, which include inpatient adolescent psychiatry, orthopedics, acute neurorehab, and emergency nursing. She is currently the nurse manager of a 26-bed surgical unit at Kaiser Santa Clara Medical Center. And she will also be joined by Celeste, who is currently the Nursing Director for Adult Services, which includes critical care, medical, surgical, telemetry, and dialysis services at Kaiser Permanente Woodland Hills. She's the Chair of Nursing Performance Improvement and Safety Program, as well as the project lead for many of the clinical strategic initiatives, including the Nurse Knowledge Exchange Plus, which you'll be hearing more about. Celeste has worked in several healthcare organizations throughout the U.S. and has held a variety of leadership positions in nursing and hospital quality, as well as multiple education positions in both hospitals and universities. She's earned her undergraduate degree at Duquesne University and her graduate degree from Sonoma State. And so we are going to pass the ball over to Christy, who's going to lead off this discussion now.
And now.
There you go.
Terrific. Okay, thank you guys. And so just so that you know, sort of technically what I'll be doing is sharing my desktop because we do have a few videos that I wanted to share. And I did want to really thank Tracy and Celeste. It's ladies like Tracy and Celeste, whenever I think my job is a little tricky and I'm a little busy, I can reflect on people like Tracy and Celeste who would run circles around me and who really make things happen around here. So thank you both for joining today. All right, so let me share my desktop and hope that no one plays any jokes on me. There we go. Okay, can you guys see a slide that says Infrastructure of Design?
Yeah, we can see it.
Yeah. Okay, great. Great. So hello, everybody. So what I'm going to talk about today is I'm going to start off with a broad picture of what I call our infrastructure of design, and it's how we approach, one of the ways in which we approach innovation at Kaiser Permanente, and it's a particular focus area of the group that I work in. So I'm going to set sort of a broad context about some of these components, and then I'll go into a case study, and that's where Celeste and Tracy will play a bit of a role for questions you guys have or sort of building on comments that I might have. They'll keep me honest. All right, so let's get started. So infrastructure of design, what the heck is it? So it's people, spaces, tools, networks, and methodologies that an organization has in place to support continuous innovation. And that's really the key here, is around continuous innovation. If you think about, in the world of music, we've all heard of kind of a one-hit wonder. And while being a one-hit wonder is better than not being a wonder at all, it's not near as good as being a classic band that goes on forever. So what I'm going to talk about are some of the things that we've found over time that have really helped to enable us for continuous innovation. And for those of you on the phone, you're a part of a group like this because you also have a natural bent towards innovation and improvement and making things better. So a little bit of this is preaching to the choir, but what I am hoping is that it might just put a different lens on how we look at it to reflect on your own organization about what components do you have in place, what components might be interesting additions to what you have, and what are things maybe that you have that we don't even think about. So I always sort of love to brag about what our group has, not just my group, but what our kind of innovation infrastructure has been able to accomplish at Kaiser. So in 2010, Kaiser was named one of the most innovative companies in Fast Company. That was very exciting. And also in that same year, the Harvard Business Review featured my group, Kaiser's Innovation Consultancy, called Innovations at the Front Line of Healthcare. And so it's specifically focused around how a national function engages with people in the front line to create impactful and sustainable innovation. So something I'm very, very proud about. So let's talk about it. So I'm going to go through a few different components that I mentioned earlier. So let's start with space. So a space that we have in particular, and don't know how many of you all are familiar with this, but is the Garfield Center. So the Garfield Center is a wonderful space within Kaiser Permanente. It's a 37,000 square foot warehouse, and I sort of laugh at these pictures actually. These are when we first opened, and it looks much more worn in right now with, all kinds of machines and posters and all sorts of things around it. But this has been a really wonderful place that we have 160,000 employees, and this has been a wonderful space that we sort of call like our Switzerland, where people can come together regardless of where they are in our organization and really try to think very creatively and differently about how we're doing things, whether it's how we're providing care in the outpatient setting, how we're looking at services and workflows and technology integration in the inpatient setting, how we look at our families in their home environments, et cetera. And something I'd like to call out in this picture is if you look at the right-hand panels, the one on the top right is an inpatient setting, and when we first built the Garfield Center, things were a little bit higher fidelity. They're not equipped to be sort of seismically active. We don't do patient care here, but you can see they're pretty high fidelity. And A new evolution for us in the last few years is actually doing what you can see at the bottom right, are more of these built environments that you can quickly reconfigure, almost like Legos or a stage set, if you will, so that you can quickly configure a room size. We have foam core sinks and beds and all sorts of things that you can put into the environment and enact workflows to see what the impact of space would be. So those have been some really great evolutions. You can see here some examples of many of the things that we do here. So we have simulations, we try out things around virtual reality, workflows, as I'd mentioned, rapid response team, prototyping of spaces, technologies, and so forth. So it's been a great inspirational place for us to be able to come to try out many things. A caveat I'd like to give is you don't have to have a 37,000 square foot space to be able to do some of these kinds of things, but it's intentionally thinking about what is the role of space, what nook or cranny might you have in your organization that really is dedicated to where people can come and think differently. It's thinking creatively and thinking differently is actually quite difficult when you're in the same environment where you're, trying to put out fires and answer phone calls, et cetera. So this is just how do we think about removing people from those environments periodically to really be able to think a bit more free. So let's talk a little bit about tools. There are many tools, can be physical tools, they can be virtual tools. This is one example. This is what we call at Kaiser, it's our idea book. It's a little bit like a corporate Facebook. So this is where people can collaborate virtually. They can post ideas, they can post links, they can start conversations back and forth. You get ratings the more that you answer people's questions and connect and so forth. Idea Book has also become a place where if you might be in a work group, the Idea Book can sort of provide this ongoing dialogue between the different group members. So this has been a very interesting tool for us. Where we are continuing to develop is not every frontline clinician has access to things like this. So that's kind of our next stage of development right now. It's more for people that I guess would have a quote-unquote desk job. Makes it easier to access desktop types of tools. So that's something that our organization is currently thinking through. Another type of a tool that really helps with the infrastructure of design and being innovative is actually, I would say, some of the tools that are the favorites of our group. So these are these physical tools, these prototype supplies that you can take a very complex idea and you can build it out with cardboard and drawings and sketches to put together your ideas in a way that you can really help to collaborate around them. There are many reasons to physically develop your ideas. Sometimes we say we go from brainstorming into body storming, which is really taking your ideas from a concept into something physical. And these physical prototype supplies really help with that. So it helps for you to communicate more directly. I think we've all been in those meetings where we may spend 2 hours discussing ideas that we have and walk out and everyone still has a different idea about what we actually came up with. So using prototype supplies to begin to get very physical about what you're thinking about is really a wonderful way to be more innovative and to use techniques and tools that folks in the design community have been using for years. Talk a little bit about networks. So networks, when you look at the value of a network, networks are places that, I'm going to steal shamelessly from my colleague Chris McCarthy on this. He was giving a presentation about networks the other day, and what I really loved about it is he talked about networks. Really the key to a really great network is being friendships. When you think about beginning to cross over that line from being very sort of remote and distant colleagues into establishing rapport and becoming friends with people, exponentially you start to share more. So, for example, when you start to know who the other people are, what they're doing, what they're struggling with, you begin to open up and share more freely about what's working and what's not working, and that's really when you start to tap into the true value of a network. Here at Kaiser, we have a couple key networks that I wanted to give as an example. One is what we call our Garfield Innovation Network, and that's an internal grassroots group that doesn't have a particular deliverable or work plan. Basically what it is we're a distributed group of people, just like you all are on this call. This is an excellent example of a network. And we just get together once a quarter and just say, hey, what are you guys working on that's really interesting that you'd like to talk about? That's our innovation network. So we're looking at in the future, continuing to develop those relationships and what those folks are doing. But that's where it is right now. It's really just starting to get to know each other and share in a very open forum. The Innovation Learning Network is another group, and the Innovation Learning Network was started from a grant and is now a member-funded network, and you can see here on this slide the various array of network members. And again, this is the idea here is these folks come together and share what they're working on, what actually, quite frankly, hasn't worked for them that they've been doing. They reach out to other groups for questions, for pointers about what they're trying to do. Has anyone else attempted to do this before? What have you learned? So it's been a really great way of leveraging back and forth between these various different groups. People. I think that people are really a key. There are many different wonderful groups within our organization, and the time frame that I have, I can't go into detail about all of them, but from a selfish perspective, I would love to highlight the group that I'm a part of here. So if you're wondering who the person is that's talking, if you look at that picture of the person standing up to the top right with long hair, that's me. So our innovation consultancy started about 8 years ago, and I think there's something that's very unique about this group. So when you think about people as a wonderful resource within an organization, there are sometimes, I think, as organizations, we make mistakes about how we use people. So if you think about most of our organizations have come across this. There's a topic, for example, that you want to focus on and that you want to, a challenge that you need to work on. Typically what organizations do is they look in their organization, they pull together a work team. And most often this is a work team that hasn't worked together before, and they come together around this particular challenge. And they're given a certain amount of time and a certain amount of resources, and they tackle it as an ad hoc team. So after that project is over, those people go back to their jobs. They go back and they might tackle something, a different project with other people and so forth. I would love, in part of the dialogue at some point, to talk about, have you guys come across that in your own organizations? What I would challenge us to think about is there's a significant flaw in that particular design, if that is the only approach that we use. And really the significant flaw is, as people, we inherently require a ramp-up process, and we have to learn about how do we work together, what's your role versus my role, what are the skill sets you bring in versus the skill sets that I bring in, and we're attempting to do something very innovative, but we haven't gone through this before. So if you look at a group like our innovation consultancy, we've worked together before, we have a much faster ability to ramp up to a particular project. And over the course of time, the more of these initiatives that we take on, the more of these challenges that we try to tackle, the better we become at attempting to do it, because we're inherently developing a skill set. So, and those are the kinds of skill sets that oftentimes we rely on external groups to do. We hire very expensive consulting firms to come in and bring their wisdom and bring their talents to help us. Our perspective and our approach as innovation consultancy is we pilfer learnings from other outside consulting firms to make our own. So we are very direct. If it's a project that we need to take on and it's a skill set that we haven't done before, we are very direct to say we might be engaging with an outside consulting firm. Let's say it's around getting more expertise on behavior modifications. We really want to get more expertise around behavior modifications, and so we're going to work with this gentleman named B.J. Fogg, who's a professor at Stanford, and this is an expertise area of his. We'll be very clear that we're working with you because we want to internalize this skill set while we're doing this project. That way, the next time this comes around, we'll be able to do this ourselves. So it's a bit of, teach a man how to fish. That's our approach. So that's a great way of having it sustainable innovation over the long run. Another approach is that, we look at, there are two key things. we're asked to look at the impact of what are we contributing to the organization from a metric standpoint, a financial standpoint, and so forth. But also a key is bringing joy into that. And so those are two very clear things that we look at. And what we've learned over time is if you're not bringing some kind of joy, or at least bringing less pain into the organization with the activity that you're trying to do, they're much less likely to be sustainable. So really looking at the financial, the measurable quality, et cetera, impact, along with the joy or reducing pain for the people who are attempting to do that. That's really the essence of having a human-centered design approach. You're designing solutions for the people that are in your system. So I want to give you an interesting example of bringing a little bit of joy into something. So bear with me as I toggle between screens here. All right, here we go. Let's give this a shot. That video. So, you know, when you look at a video like that, I think it's a really nice way, one, of stepping outside of our industry and thinking about, you know, how can we really tackle some of these challenges that we have in a very different way. You know, yes, we work in a very serious industry, but there are ways that we can decrease the pain of doing some of the things that we do, adding some joy into it. And that's something with Tracy and Celeste, when we get into the case study, is it's not even just about the idea itself, but the path that you take to get to the idea, the approaches that you take to engage staff and managers and so forth. And actually, I might pause for a minute. Tracy and Celeste, do you guys have any comments about that in terms of engagement when you all were working to just even look at the concepts of the nurse knowledge exchange?
Well, I'll start. This is Celeste. It was very interesting with me. We've done now, since you came down and did the project with us the first time, our pilot project in January, watching the staff's involvement, and then when we did our second one, how many start out so negative, and within 2 to 3 hours, using the method that you use of engaging them in the process, walking them through the steps, allowing them to be the champions and coaches, that by the end of the night, which is an 8-hour process, how they are the ones that are truly championing it and moving it that quickly.
Yeah.
Hi, this is Tracy. Can you hear me?
Yeah, we can.
Oh, great. I have to say that I've never participated in an effort like this before, and it really gave the frontline staff an opportunity to not be directly taking care of patients or whatever their normal job was, and let's look at things from a totally different perspective. And what do you think? What would make your job easier, better? In your perfect world, what would that look like? And giving people the freedom to explore those ideas along with their peers. They really had some aha moments about one another and really created such phenomenal engagement that now if something comes up, well, what do you guys think? And someone invariably will come up with something that maybe never occurred to me. So it's how can we do versus how can I tell you how to do? And it's, you know, it's really, we get a lot of initiatives in healthcare and different industries that say, this is the best way to do it, and you must do X, Y, and Z. In the relationship we developed with you guys through the Innovation Consultancy, it was more like, this, we're here now, and we want to be here. How do we, what does X, Y, and Z look like to me? And to get the end product. And it really opened up a whole different way of looking at things and really empowered our staff to really get engaged in the work that they do every day. Thanks.
I agree, and I think the methodology was the piece that I think was so enlightening, is that most times we do much discussion and education before we begin the project, and then you try to pull people along, where I think this engages them right at the beginning, so that as you're doing the project, they're actually pulling other people in with them and making them part of the whole team versus it being more leadership making them move along.
Great. Thanks, guys. And so I think that's a great tickler for when we get to the case study, giving some actual examples of how do we engage people, what do we do. So which actually, Tracy, you had mentioned the process. So these are the main steps of the process that we use when we do human-centered design. So we call it kind of a nice mashup between art and science. It's really the art of, there we go. The art of innovation with the science of improvement. I think that creativity, that bringing people along, is something that designers have done a wonderful job for years, and bringing those techniques into the healthcare world is really where we get the concept of human-centered design. So let me give an example. Oftentimes when we get an initiative within healthcare, we take it and the focus is just on convincing people to do it. You know, if we just give them enough information about this, they will just do it because it's just the right thing to do. When you look at human-centered design, you start to say, well, what is the purpose of what we're trying to do? What are the elements of this change? You know, what are the kind of the components of it? And getting the staff involved in whether it's some customization and how they test it out and how they're messaging it. And that's some of the things that you heard Tracy and Celeste talk about, where they begin to become champions in how this actually works in their unit, within their setting, or in their clinic, what have you. So that's really where human-centered design comes in, is we're not just doing something because we've read about it and heard about it and it's going to go in lock, stock, and barrel right into the setting. We're actually involving the people that work in that setting to make it work not just for the patient, but for the people that are caring for them. That's a human-centered design. So we have steps that we follow along that, and you can see them here. Understand, that's when you really gain empathy for who the audience is, empathy not just for the patients, but as I said, also for the clinicians or support staff that are working with them. What are those situations, what are those environments really like? Looking for the big themes, the big patterns that are coming out of that. Ideating is really beginning to think very creatively about what could the potential solutions be, how could we tackle this challenge. Prototyping is getting very physical with the ideas. Trying and getting feedback is where the tests of change come in. And then piloting and measuring, and that's pretty self-explanatory, but really going out and seeing what the impact is. So let me go through. My computer's frozen here. Hold on. Let me. This isn't so great.
Tracy, we can also put it to the slides on the WebEx if that's frozen.
All right. Yeah. Let me try again. There we go. Got it.
Okay.
Thanks. So here is the case study that I'd like to go through that walks along some of those steps. So this is Destination Bedside. This is about nurse shift change, a design thinking case study. So many of you might be familiar with this. So this is an inpatient example, but you can I think, easily start to translate some of these examples into an outpatient or home setting. So tape recorders, we started off back in 2004 with the good old-fashioned tape recorder. So if you were to go around and look at most of our hospital units, the way that nurses handed off information from one shift to the other in the hospital setting was a tape recorder. You would hit record and you'd record information about your patients into the tape recorder, and after a certain amount of time you would have all the different recordings there from all the nurses on that shift. The new shift would come in, they'd hit play, and they would listen to all the report outs about shift change. What we saw is when we asked nurses, well, you know, how's that working? They'd say, you know, it's fine. And you know, we said, well, so what's the patient's role in shift change? And the answer was, well, shift change, that's actually about nurses. That's not about patients. Shift change is something that nurses do. So this is where gathering insight and using techniques to really understand more deeply from a human-centered standpoint, from the providers and from the patients, what the situation is. So nurses were saying, yeah, it's about nurses. Patients, when we ask for them to draw, well, what does shift change mean to you? That drawing is another technique for gaining insight and understanding. This is a perfect example. So this is a drawing that one of our patients did for us, and he just took a piece of paper and a pen and wrote before shift change, and you can see a happy smiling person, and then during shift change it says, where is everybody? So clearly shift change did have some sort of impact on our patients, even if it was just, where in the heck does everybody go for this 30 minutes? I can't find anyone. So this became a great kind of fodder for conversation over time. What I want to show you now is another way that we capture insights about what's occurring with our patients or with our staff. So this is actually a different kind of video. This is in a home setting, but this is another technique when we talk about methodologies to really understand people's viewpoints. So this is just a very quick video. This is of a patient, this is of a patient's family member, and what it looks like when she goes home to manage her medication. So again, when we're talking about an infrastructure of design, there are many techniques to use to pull out what you're trying to solve for. So here's one example. This is a video.
I took it to the clinic because the endocrinologist may have questions, but normally it stays right here because I have it arranged. When he was discharged from the hospital, this is what they gave me. Henry, do you have the oxycodone? One of the first. Okay. Yes, it stays on the stove. Yeah.
I'll let you put it in the cup.
Yes. I always do it with a cup.
Okay, got it.
And it goes with his meal.
So that's, I think, a very simple example when we say, you know, really understand what you're designing to, what challenges are you really trying to meet, and getting out there, whether it's through drawings, through videos, through observing, you start to really get a deeper understanding about what are you actually trying to solve, what are the actual challenges that are happening. So it's very important for all of us to get out from behind our desks or our conference rooms and really experience what's really happening. That's where the real design challenges actually will present themselves to us. So another part of our methodology that I mentioned is ideate and prototyping. So when I had said earlier, we've got all these physical tools that we love to use to actually try to make solutions much more tangible. This is actually a snapshot of a lot of clinicians who came together to try to design new solutions. So you can see we had a patient bed that was available. They built kind of a little mock patient room right there, and they were enacting some solutions that they had. They created a little whiteboard in the back, and you can see some things that are stuck up on the IV poles. But they started to get very physical about what are their ideas, what is it that they're trying to solve for. We did the same thing when we were trying to do NKE+, is we ask for people, when you're brainstorming solutions, let's brainstorm those ideas and let's build them out and get very physical. So again, I'd like to show you guys a video of people, what this means when we say get very physical with your ideas and enact them out. So this is kind of a shout out for those of you who are physicians on the phone, that physicians can be wonderful actors too. So let me show you an example. This is actually from some physicians that we worked with in a clinic setting, and this was their challenge was around patient satisfaction, in particular getting a patient's needs met during their clinic visit. So they had gone through the same activities of brainstorming and prototyping their ideas, and this is where they took their physical prototypes and they acted out what a future scenario should be. So some of the things that they had listed of ideas is, personal greeting in the lobby, a handheld device that gave the physician personal information about people. They had all these different ideas, but reading those ideas and actually seeing how those ideas might possibly work in a future setting is like night and day. So let me show you their quick enactment that they did in one take with 30 minutes of making up a scenario.
Oh, that's cool. Enter a Kaiser number or swipe your Kaiser card. You want a volunteer guy to do the clinic today? Yeah, I'm not too tech savvy. Let me get that going. Well, hello. My name's Mike. I'm asking to volunteer for this office, and I'm here to escort you to your appointment. Before I do that, let me just show you that we have a Kaiser boutique here with some apparel for sale as well as some health-related materials. Let me just take you to your office. That looks like the Harley shop up the street there. Yeah. Here you are. Thanks.
I'm looking on my handheld device that identifies the patient, shows me a picture, and tells me some personal information. Hi, Lynn.
Hi, Dr.
Nice to see you today.
Good to see you.
Hey, how'd that triathlon go that you just ran?
Pretty well. My first one, but it went okay.
That's a great accomplishment. I think so. Why don't you come into our office and have a seat? So what brings you to see me today?
Well, it might be that triathlon, but I'm a little sore in the hamstring. Hanging on, so I thought I'd take a look.
Okay, yeah, we can help you with that. Did you have any other concerns today that you wanted to bring up?
Not at the moment. 10 minutes go by.
Okay, now, do you have any questions about what we just went over?
No, I think it's pretty clear, ice and rest and, should get better.
Okay. Is there something else I could help you with today?
Well, actually, I did have this list of other items here.
Okay, great. Yeah, we want to take all the time we need so we can address all of your concerns today. So, okay. So here is your after-visit summary for the day that lists all your diagnoses and our instructions for home care. Also see you need a couple of labs and we need a tetanus shot. We can take care of that today.
Oh boy.
So any final questions?
No, that's it.
Okay, there you go. Let me escort you out. Thanks for coming in today.
Thank you.
We really do appreciate you choosing us to be your healthcare provider. So here's a little thank you card signed by our whole team for you.
Wow, that's never happened before. Thank you very much.
You're welcome. Take care.
You too. Thanks.
Hi, I'm the clerk. I just wanted to make sure all your needs were met and you didn't have any other concerns.
No, I think that's pretty well addressed it. Thanks.
Okay, well, great. Thanks for coming into our clinic today.
Thank you. I got my new cool jacket.
Great. This is so hard to do on mute. I'm looking for laughter or feedback, but so that kind of gives you some sort of example, a little backstory. We'd actually taken them to this was a one-day event, and we had taken them to the Harley-Davidson shop up the street for inspiration about how Harley-Davidson actually works with customer service and customer care to get such a passionate following. So that's the shout out to the Harley-Davidson shop. They made their own Born to Thrive jacket. But I think that gives a nice example of if that list that you saw there at the end of the video that listed off, here's all the ideas and concepts, if you were to just see that list, you would have one impression in your head about what that actually meant. and another person on the phone would probably have another impression, and another person would have another impression. But getting very physical with those ideas and actually acting them out creates a whole different dynamic. And so those are some of the techniques that we use when we're actually trying to design solutions. So we did the same thing with our NKE+. Now these are some photos that you can see here when we actually went then out into the field to get some ideas about NKE+. So NKE+ is really about supporting nurses at shift change. And so you can see some images here of people trying out the ideas of, sketching out who might be involved in what. And I think something also that's really important, and Tracy and Celeste as well, if you have something to add in, I'd love if you can kind of talk a little bit about this picture on the far right about why we did this, about getting the voice of the nurses out there, kind of how that fit into the process of trying out ideas.
Hi, it's Tracy. That's my nurse, Sarah. And the interesting part about this was everyone has an idea, and this the poster she's standing in front of listed different things at the top. You really can't see what part of it, but the nurses could put up little Post-its and say, I like this because, or I don't like it because. And it could be anonymous if they wanted it to be. Someone could come along and read all of those and, really give them a chance to think it through themselves, and then they would add something to it. So the anonymity of doing it that way really helped a lot of people that maybe wouldn't be comfortable speaking in front of their peers, or, just we haven't ever had the opportunity to work in this manner. So it was very engaging. And those are all the nurses' handwritten little Post-its, what I like or don't like. Thanks.
Thanks, Tracy. And I think a key there is when you're trying to either design a new solution or spread an existing solution, these likes or dislikes, particularly the dislikes, will come out at some point. So I think it's give that the opportunity to surface early when you're trying that out at a very small scale. If you look at tests of change and piloting as a way for people to start seeing, what do I think about this? How is this actually working? And create an environment where those discussions happen very early. It will help you to create solutions that are really working for the people who are doing them and for the patients that we're serving, instead of a backlash blowing up later on because you find out, 6 months later, people never actually wanted to do this in the first place. So really providing that context in those forums for people to have open and honest dialogue very early on when you're in those very initial testing phases is really, really important. So this is what Nurse Knowledge Exchange, after doing all of those things, actually became. So Nurse Knowledge Exchange is about looking at shift change beyond just the shift itself. We learned, without going into a whole lot of detail, I know everyone here isn't a hospital-based person, but the idea is that we had been looking at shift change about just the 30 minutes of overlap between the different shifts in a hospital setting, and then wondered, well, why isn't this sustaining itself? And what we really learned is that shift change is about more than that 30 minutes. It's about what happens at the end of the shift before. How are patients' needs being met in a final hourly round? Are nurses coming on to their shift with the shift ready to receive them? Assignments are made, things are ready to bring them on to their shift. Without it, it's a little bit like if you are a manager and coming on and starting your day and your computer doesn't work. Well, you're really starting out your day poorly, and you're not going to be very productive if the basic things that you need aren't ready to go. So that's what's happening during the end of the shift. And then during the shift, we looked at shift change being more about holistically what are all the roles and functions of the people on the unit. It's not just about getting the nurse to the bedside to have a great exchange with the off-going nurse and with the patient. It's also about what are the roles of the other people there on the unit to help to support that interaction. How are phone calls being answered? How are call lights being answered, et cetera. So that's what Nurse Knowledge Exchange Plus is. So it's when I gave the term a human-centered design, this is very much of a human-centered design. We didn't just say, nurses, you at all costs, you have to go into that patient room, even if call lights are going off and you're getting new patients that admitted that you have to answer the phone on, et cetera. We're saying, you know what, this is important, for the nurses to go to the bedside, so let's look holistically about how as a unit we can support that happening. So it was designed in a very human-centered way. So here are some images. Actually, there's Tracy. So if you look there and the top right picture, the woman in the pink cardigan with the funny plastic hat on, that's kneeling down the front, that's Tracy. So this is some examples of, really starting to get the staff involved in how they make it theirs. How do we take this suite of solutions and get people involved in creating it so that it works for their unit, their staffing model, et cetera. So that's what we uncovered each time this begins to get implemented and spread from place to place. And Celeste was mentioning that earlier about one approach that we did is, for 8 hours we had a group of champions of nurses and support staff that actually focused on learning about NKE+, going out and trying small tests of change, learning how to do those tests of change, talking with their peers and understanding how that happened, making adjustments so that it worked for the environment that they were in, so that making it yours was really very, very important element of the design of Nurse Knowledge Exchange Plus. And you can see from this quote that that's the kind of feedback that we're getting about how this feels different. So this is a quote from a nurse that says, "You don't even know. It's so rare that people tell us why we're doing what we're doing. Usually they just say, here, this is what we're doing now. And it's even more rare that people ask us what we think about the idea and how it might be better." So that really gets to the whole idea about when we look at creating new innovations or spreading existing improvements, it's why are we doing it and what ideas do they have to make this even better, getting that involvement in the very beginning. So this is just a little bit about what's next. These are just other projects. We're starting now to, NKE Plus is spreading across our organization. We're working with technology teams to look at how can technology support us and the workflows of other individuals like transport and housekeeping, et cetera. We're looking at mocking up how the room can be designed to help to support the environments and the interactions we're looking at, and many other things. So to summarize, when this topic around an infrastructure of design, I gave some different kind of fundamental examples of space, the role that space plays in creating an environment for people to come to be very creative and think differently. Tools, whether it's an online technology tool or, good old glue and tape and scissors and markers. People, the role that people play in there and continuing to develop internal skill sets so that you can replicate your approach over and over again. Processes, having a process that you can understand and that you can follow to be more creative, and that's the methodology that I showed you. And there are many processes that people have, and they're all going to be slightly different, but have something that your organization understands that you can replicate and you can get better in. And networks, how you start to connect with other people and other organizations to share your ideas, to ask for help, and so forth. So that's the end of my presentation, and we like to say if it ain't fun, we're doing something very wrong. So having fun so far. So we can stop if you want to ask me or Celeste or Tracy any questions, and while you guys might be gathering any questions that the group has, Celeste or Tracy, I don't know if you guys have anything else that you wanted to add.
This is Celeste. I think the one thing that was a great learning from this is as you do project after project, which in healthcare we have many ongoing, that it really allowed us to step back and think of the fact that we needed to be more innovative in our projects that we roll out for our staff. And we do need to make sure that as we're gathering the information to start the project, we allow them to be part of the process. As we do the rollout, we let them feel what it feels like and be open to change while we're doing the rollout also. So I think it really helped us to kind of rethink how we're doing some of our even current projects to make it more fun, more interactive, and more engaging, and therefore we think it's going to be more sustainable.
Hi, this is Tracy. I think it really, just the whole process has really impacted our unit culture. We look at things from internally in Kaiser, and I'm sure other companies use similar formats. The SAQ, Safety Attitude Questionnaire, evaluates our culture of safety, and the People Pulse kind of evaluates how people feel about us organizationally and their leadership. And ever since we've done this work, our results have been very positive, that the staff, they'll ask questions like, if I have a problem, I can talk to my manager, or my opinion is important. And just bringing that forward, that no matter what the issue is, it could be something really small that someone goes, hey, wouldn't it be better if? And everyone's like, oh my God, that's a real aha. And that people feel comfortable enough to bring that forward, and then we act on things like that. And every idea is not a great idea, and we learn from that too. And so there really isn't a wrong answer. A few weeks back, just a short example, we decided that we would take all the phones at the end of each shift and hold them so that the nurses wouldn't be interrupted by a phone call during that NKE handoff. And from my end, I thought, what a fabulous idea. They don't have phones. They're not going to get interrupted. Well, the nurses said, how can we be meeting our new patients and putting our phone number on the board to tell them how to reach us if we don't even have our phone yet? I don't know what my number is going to be. So it's a constant learning process, but where that you can have that open dialogue. People just don't go, okay, so-and-so said we must do it this way. So people are free to come back and say, hey, I understand, but would it be better if? And that we explore those routes. And I just thank Christy and her team for bringing that type of thinking and that openness to my unit in particular, and then teaching us how to share it. Thank you.
So, Christy, I have a question here from Kathy Coleman, which is, how did or do the TPMG staff utilize the innovation consultancy, and how often is the People Pulse done?
Okay, so TPM staff, for those of you that aren't Kaiser, is the Permanente Medical Group. So that's the physician group in Northern California for Kaiser Permanente. So we would work with TPM staff if it was a project that we were doing in Northern California that involved physicians. Then the physicians within that pilot site would be a part of the work that we were doing. So our group is housed within, if you're a Kaiser person, are housed within the hospital health plan side of the house. So folks in the physician groups would be involved when we do projects, particularly in the field. So, for example, when I showed you that medicine and management, that was a kind of a training that we did for some of the physicians. We also, in that picture where you could see a lot of people that we brought together and they were acting out a new approach. You could see the hospital bed that they brought in, that picture. We will always have physicians as a part of the designing of the new solutions and brainstorming and so forth. So they're involved just like nurses are as we do a project. So we bring in a multitude of various kinds of staff. How often is People Pulse done? I think as an organization we do it yearly. My organization doesn't do it, but I think that's the question.
And what is People Pulse?
It's a employee satisfaction tool. So I'm not sure if there's more to that question. That's not administered through my group. It's just it's a employee satisfaction tool. So that's done, I think, through our HR group, and it's done once a year. I'm sure there's probably more to that question. But
hi, this is Tracy. Just a little about People Pulse from my end of it. It's kind of how we gauge. It looks at things in teamwork, also looks at cooperation, management, just cultural diversity, how are things, it's kind of the pulse of the place, if you will. And Kaiser Permanente does it annually, and we take a look at our low areas and our high areas and celebrate our successes and kind of teamwork, problem solve how we can improve those other areas. And it's not a Kaiser-centric tool. I believe it's a validated tool for that type of work, and I'm sure you could probably find out more information online about it, but I'd be happy to try to follow up if someone needed more. Thank you.
Great. Any other questions? You've wowed them.
They're all eating.
I know. People have got their phones on mute and they're busily trying to eat. So this has been fabulous, and I think, one of the things I know that many of our listeners and many of our CIN partners struggle with is when you have these better ideas on how to provide care, how do you really engage the staff who are supposed to be making these changes? And I think you provided some really concrete ways of helping people think about how do you engage staff, how do you really make sure that the better idea or the better way of doing things is really part of the culture of how the staff does their work, with the kind of buy-in and, frankly, tweaks and improvements that only those folks on the front line can really make. So with that, I think I may end us even a couple minutes early. And thank you all very, very much. And we're going to end the recording. I just want to let people know that there will not be a CIN webinar next month in August, but we will be resuming in September, and our next call will be on September 28th. Thank you.
All right, thanks. And I'll just, Sophie, I'll just stay on here until 1:30 in case somebody has a last-minute question. I'll just stay on the phone.
Oh, here's one. Do you see it? What kind of skills and experience do you look for in members of your team?
Oh, you know, I would say this is going to sound like a strange answer, but I would say curiosity and a sense of humor are two very important things as far as basic skill sets. The backgrounds of our team are very diverse. I'm a nurse by trade. I did home health. And other members of our team, we have people who are product designers. We have people who are communication designers. We have people who are we're service leaders, an architect, an English major. I mean, we're all very, very different in terms of the backgrounds, but I think some very common things we look for are people that are, well, quite frankly, good people, and that have a natural curiosity, that want to try new things and aren't afraid of taking some risks and making some mistakes, and that can have a sense of humor about, you know, what we're doing and how we do it, because I think it's really important when you're engaging other people is to be able to be humble, to be open and curious to new ideas. So at the end of the day, we don't own any of this. This is about people like Celeste and Tracy and the groups that they work with. It's not about us. And so I think those traits of really focusing on the people is important.
That's great. Thank you, everyone. Again, we actually now are actually at the full hour. And so we're going to sign off, and very special thanks to Christy, Celeste, and Tracy for their time and for being so open about sharing their experience.
Thank you.
Thank you.
All right, thanks.
Bye-bye.
Bye-bye.
And Sarah, I'm going to ask you to stop the recording, and then you can shut this down.